Gail?
Okay, am I on here? Can you hear me? My task was to review the health, food, and nutrition environment, and I'm going to mention 4 specific food and nutrition trends, and then end with a story of hope, symbolized by these freshly laid eggs here. Number 1, our socioeconomic indicators are describing our populations at risk, which are the old, the young, and the poor. We know that we're an aging population. We're becoming more racially diverse and promise to do so in the future. And data shows major disparities in health and access to health care by socioeconomic status, race, and ethnicity. The improvements in health care are not distributed equally as well. And the poverty rate is highest among our children, who are therefore at highest risk for obtaining healthful diets. So that's the first set of trends. The second is that our health status and the prevalence of some of our diet-related diseases are getting worse, especially for vulnerable populations. Specifically, the prevalence of diabetes, obesity, and overweight have increased markedly in the last decades. The third trend is that our current consumption patterns for most people are inadequate to promote good health. And using fruit and vegetables as a proxy for this, we know that adequate fruit and vegetable consumption is often the limiting component in a balanced, healthful diet. Yet, fruit and vegetable consumption does not meet the minimum of 5 servings a day for 70% of adults. And this is probably a higher percentage when we consider that the standard is now 9 servings a day of fruits and vegetables. And now a little bit of a glimmer of hope. Food purchases from small to mid-scale family farmers, regional and sustainable growers, ranchers, and fishers has increased exponentially in the last few decades, but it is still a small portion of food purchases and sales. We saw from the latest agricultural census in 2007 that direct sales increased 50% from 2002 to 2007. The number of farmers also increased 7% from 2006 to 2008, and they're now numbering over 4,600 nationwide. Number of CSAs increased 40-fold from 1990 to 2009. And the number of farm-to-school programs, which are those programs that encourage procurement of farm-fresh foods for school meals, have increased to over 2,000 and are now in 40 states across the country. At the same time, however, superstores are becoming the major venue through which consumers are buying food. One recent report showed that the percentage of food expenditures through superstores went from 0.4% in 1986 to 18% in 2006. And now I'd like to end with a bit of a hopeful note. I don't like to end on the downside. And that's a story. About 1 year ago, a group of whom I'll call radical nutritionists, some of them are in this very room, gathered at the Kellogg Food and Society Conference in Phoenix. We were inspired by the work of Dr. Joan Gusso, Kate Clancy, Marion Nessel, Michael Pollan, and others, and we agreed that a clear definition of healthful food was needed. Since then, we have worked and reworked drafts and vetted widely a document that is now, this is under the guidance of Leslie Mickelson at the Prevention Institute, and it's now publicly available on their website. 3 days ago, I heard bits of this manifesto read at the 4th Farm to Cafeteria Conference in Portland, Oregon by Joan Gusso. And since most of you didn't have a chance to be there, I thought I would just, in the next 1.5 minutes, review a couple of excerpts from that document called Setting the Record Straight, Nutritionists Define Healthful Food. I believe this summarizes some of the trends I've just outlined and suggest a vision of where we want our food system to go in the future. Healthful food is essential to healthy lives and to a healthy society, environment, and economy. At a time when people are experiencing unnecessary death and chronic disease, where food plays a significant role, we are compelled, personally and professionally, to promote the public's health and to advocate for access to healthful food for all. Our definition of healthful food is not limited to the nutrients that a food contains. Our definition recognizes that healthful food comes from a food system where food is produced, processed, transported, and marketed in ways that are environmentally sound, sustainable, and socially just. As health and nutrition professionals, we stand for a food system in which wholesome food is the norm. We support the following principles which provide a definition of healthful food and a framework for developing programs, shaping community food systems, and advocating for food, nutrition, and agricultural policies that truly promote health. And these principles, in a very small nutshell, are: healthful food is wholesome. Healthful food is produced, processed, and transported in a way that prevents the exploitation of farmers, workers, and natural resources and the cruel treatment of animals. And healthful food should be available, accessible, and affordable to everyone.
That's great, Gail. Thank you.